Can you expand a little bit about your work?
Sure.
And your teachings?
So that was about 25 years ago. In
Wow.
1983, I started as a chiropractor, and that work was mainly addressing the physical needs of my patients. And about 12 years after that, I realized that some of my patients, some of those physical complaints that they had emotional connections as well as nutritional connections. And eventually I realized there were also spiritual connections. So at about 13 years ago, I realized that I needed to move my practice to a place where I can integrate the emotional, spiritual pieces. And that's why earlier you said the mind, body, spirit connection.
Yes.
So, because some patients are not going to get well physically if their mental, emotional, spiritual material is not resolved. Needs are not met. Yes, yes.
Okay.
So I went back for more training and eventually learned a little bit more. Certainly more, I learned quite a bit more from the Eastern philosophies, you know, from how the Chinese approach health.
When did you, in other words, when did you start thinking, okay, let me apply these other laws, spiritual laws and emotional? When did you, what time and place in your life did you think, okay, this is working, but I would like to better it?
Yes, yes.
And so it's wholesome, it's whole, it's whole,
I think
body, mind, and spirit?
Right. It was about 93, 94, and I started looking at some of those patients that I've been working with for a number of years who just weren't getting well. Even when I referred them out to medical care, they just weren't improving. And so I focused on those tough cases that I've had over the years who did not improve. And I said, why? Why are they not improving? And I realized that in order for those folks to improve, I had to integrate those other realities, those other aspects. I had to talk to them.
There are other realities which a lot of people are conscious of, and some might not be. So for those that want to know.
So to give an example, when I had patients who were not getting well, I had to ask some of the tougher questions, which I rarely asked before. A question like, are you happy at work? Are things good in your home? So those aren't questions that we ask. We usually ask, tell us about your physical condition. So I started digging in more. Some patients were not comfortable with that, of course, and that's fine. But the ones who were comfortable, I feel, were the ones eventually improved.
Yes.